Along with these other medications that are given, or medication categories that are given to prevent someone from suffering from too much stomach acid, we do have a category of drugs that are classified as cytoprotective drugs. Cyto meaning cell, protective. They keep the lining of the stomach from suffering damage by just coating and soothing, especially at ulcer sites. So a drug called sucralfate or carafate is a liquid. It's known as a slurry. And you shake it very well, drink it, and it forms a protective layer, and it coats ulcer sites so they can heal. Our own pink stuff, Pepto-Bismol, which is really bismuth salicylate, bismuth being another mineral, salicylate, so that makes it in the aspirin family. It coats and soothes, as the commercial says. There is a drug, and a very interesting drug, called misoprostol, and its trade name is Cytotec, and it is a cytoprotective drug that you take, and it kind of forms a protective barrier in the stomach. Now, Cytotec has an OB use, and you're going to be discussing this in senior rotation. It's a synthetic prostaglandin, and prostaglandins are tissue hormones that both kind of help and hurt when it comes to various situations in the body, but they are protective in the GI tract. However, they also cause uterine cramping. And so you don't want to give it in pill form ever to a pregnant woman because you can cause violent cramping that could cause her to expel her fetus. When I worked in labor and delivery, we used Cytotec to help get the patient ready for labor. It would prepare the cervix by causing contractions. Now, we didn't give it PO. We got a tablet, we cut it into quarters with a pill cutter and inserted it vaginally. So we'd put it right up behind the cervix. As it dissolved, it would release prostaglandins that would just kind of irritate the cervix and start contractions. But we wouldn't give it in whole pill form, and it was actually kind of interesting because we'd take out this little package that would contain the Cytotec tablet, and it has the name, and it has not to be used for pregnant women, and here we're fixing to tear it open, cut it in quarters, and use it on a pregnant woman. But we only used it, it had its limitations. We only used it with continuous fetal monitoring. It was used in the clinical setting, not just at home. When you use any of these cytoprotective drugs, you want to drink plenty of liquids. You want to watch for darkening of stools. Bismuth salicylate can cause very, very dark stools, and it can cause kind of a dark gray or black coating on the tongue, and that can kind of scare people to death. You don't want to give Pepto-Bismol to children with virus symptoms because since it's a salicylate, it can possibly cause Reye's syndrome. And the symptoms of overdose would be the same as you have for aspirin. Ringing in the ears, it'd be what you'd hear first for the Pepto-Bismol. So you have to use it with caution. It's pink and it tastes good, but if you like wintergreen, but it has to be used with caution. So different adverse reactions from antacids, you could end up with a lot of GI side effects, supposedly weakness, because you're kind of overdosing somebody with certain minerals. If they use it too much, it can cut the appetite, cause diarrhea. Ultimately, adverse reactions could be bowel obstruction and constipation. And if you're taking a magnesium antacid, you can end up with too much magnesium, and so you would have cardiac and renal issues, and that would lead to the weakness that is an adverse reaction. H2 receptor antagonists can cause dizziness, headache, can make you sleepy. Ultimately, it might cause diarrhea, although it's usually not too big a deal. But adverse effects can be changes in your blood tests, hematologic changes, and pain in the muscles. Proton pump inhibitors, headache, diarrhea, abdominal pain, and nausea. Adverse effects can be a rash, although that's pretty rare, vomiting, and dizziness. And like I said, they do destroy little proton pump inhibitors. And so if you were to take it for a long period of time, you're getting rid of a lot of your acid production potential. And so these are supposed to be taken short term, meaning it takes at least 6 weeks for them to cause any kind of an effect, but you don't want to take it for years on end. And unfortunately, I think people are taking them for a long time. You want to assess the patient for what is going on with their GI tract. You want to look at interaction possibilities, the drugs that we've mentioned. Smoking and alcohol can increase stomach acid, so can stress. You want to tell the person to increase their fluid intake, especially if they're taking antacids regularly. You want to teach them how to administer the drug, and they should take H2 receptor blockers at night when most acid is produced. The H2 receptor blockers that end in dine, D-I-N-E, famotidine, cimetidine, ranitidine, they can affect the cytochrome P450 system, so they can interfere with how you metabolize other drugs, and so it's a good idea to take these separately at night after you take all your other drugs the rest of the day. Evaluation, you want to see how these drugs are working for people, if they are still having GI symptoms, and make sure you read all the information about patient family teaching, pages, there's a lot of it, pages 250 to 254. Now, I said we'd talk about this briefly. It used to be thought that ulcers were caused by stress, and that the more stressful a job you had, the more ulcers you would get, but it didn't really explain why some people got ulcers and some didn't. Finally, back in the 80s, after years of study, 2 doctors, Barry Marshall and Robin Warren, really connected the bacteria Helicobacter pylori, or H. pylori, with damage to the GI tract. 75% of gastric ulcers and 90% of duodenal ulcers were found to be linked to H. pylori. Dr. Marshall ended up giving himself H. pylori gastritis and then curing it, and he got the Nobel Prize in Medicine for doing that. On page 251, our book describes treatment for H. pylori, so it's multifaceted. You need antibiotics to treat the bacteria, GI drugs like cytoprotective drugs to treat the ulcer, other drugs like H2 receptor antagonists like ranitidine, and then for the gastric ulcers, and then the PPIs like Protonix for duodenal ulcers. So it's more than one drug for Helicobacter pylori.